Dzień dobry. Lexicography of harm reduction is just a posh way of saying how we tell people about how to switch from smoking to something safer. Now, across Asia Pacific, that's a bit early. Oh, come on. At least let me finish before you take the vote. In Asia Pacific, concepts about harm reduction are generally understood either dimly or not at all. And it's essential for us all to ensure that we keep it simple and comprehensible. Because much of what works in Europe, and what we've been taking for granted in this part of the world, is of relatively little use in many countries further east. More than half the world's population envies you your options. They would love the choices you have in Europe to stop smoking and switch. That's why I suggest we need to aim for greater unanimity and clarity of the language we use in the issue of what we here in this conference call tobacco harm reduction. I'd like to enlist the help of Europeans and others who are a lot further forward in the struggle for personal choice than most Asians. We need your support. Help us to gradually redefine how we talk to authorities and consumers about the public health opportunities of getting people to stop smoking and get their nicotine in safer ways. I should point out to anybody who doesn't know me that I'm based in Asia Pacific. I've been in Thailand and Malaysia for 20 years, and I'm currently in Australia in that struggle. And whether we call Australia a third world country or not is something we can debate separately. It's third world in its thinking on World Health Organization policy, that's for sure. Bear in mind that across Asia, right across that swathe of Asia Pacific, public health and consumers alike are preoccupied with what they regard as more important issues. They've got other things like sexual disease, pollution, road deaths to think about. Policymakers in particular don't see smoking cessation as a priority despite their professed devotion to the World Health Organization, much of whose money in the region goes straight to corrupt individuals. Also remember that in most of Asia, new nicotine delivery systems tend to be more expensive than conventional ciggies. So there's not a lot of consumer-driven desire to seek alternatives. Against such a background, if we don't speak clearly and simply, we simply and clearly won't get the message across. Let's start with concepts, what I call concepts. There was a recent report from Cancer Research UK which dealt with e-cigarettes and dealt very positively with them. I don't wish to criticise that report at all, but it didn't at any stage make clear enough to outsiders that those e-cigarettes contained nicotine. And that made it for an advocate like myself in Asia Pacific, where a lot of places like Australia, you are allowed to vape, in most states at least, you're allowed to vape, you're just not allowed to vape nicotine. So if that Cancer Research UK report had actually made that clearer, we could have used it with great international impact. That's not a criticism of Alison, is it Alison? And Cancer Research UK. It was done for and by the UK. But if we start thinking internationally and how we can help the rest of the world, then little things like that can mean a lot. Then there's what we might call terminology. We in Asia were thrilled a couple of years ago when the authorities in Singapore, who aren't exactly noted for their liberal tendencies, they announced they were going to regulate e-cigarettes and vaping. We were thrilled. Brought straight back down to earth when we found out that they were using the word regulate to mean ban. Essentially the same Chinese character, regulate, ban, same thing. I don't want to court controversy here, but I'd like to suggest that to help the people of Asia Pacific understand the issue, we move away from the precise and abstruse terms that we've all been using for so long. Why do we bother with harm reduction? Why not safer products? Why less harmful, not just safer? With all due respect, I can see the medical and political arguments, but these are semantic niceties in many of the countries where I'm dealing. Smoking cessation itself. It may mean something in the Far East, but only to a handful of medical experts. It certainly means nothing to the media, and the media, I think in Europe, seeing yesterday's Daily Mail in the UK, all over the world, and especially with the more obedient media in Asia, they talk about smoking e-cigarettes even today, and the consumer just gets used to it. Which brings me to actual words. The language itself. PRC, with mainland China, will be joining the contest in the very near future. In fact, Asia's been monitoring developments as they occur. We've actually done some preparatory work in Hong Kong. And so we've got a few linguistic concepts and alternatives that we can suggest, at least in Cantonese so far, for the time when it's required. But the writing is on the wall. We're doing similar work elsewhere. And I'm going to take Thailand as an example, not just because I lived and worked there for quite a few years, but it's an interesting linguistic concept. It's a very grammatically poor language. It's also a repressive regime with a corrupt state monopoly jealously guarding its tobacco industry and a hell of a lot of corruption. But we're helping local unofficial vape groups, vaping's illegal, to develop new Thai words that might better convey the issues to ordinary consumers. Coining new words, and we have the advantage because it's almost a level playing field. It's an opportunity rather than a problem, in fact. If we don't start with e-cigarette, which has caused a lot of trouble in the West, we can possibly just possibly avoid these things when we actually legalise vaping. So everybody uses the Thai word buri, which means cigarette, and sup buri, which is roughly inhaled cigarette. Those few Thai people who know about vaping and are doing vaping they call vape, a corruption of the English vape. But to ordinary Thais on the streets of Bangkok and elsewhere, vape also means a microwave. And to another group further up country, it means a particular brand of Honda motorcycle. There with web. So you can see that there's certain seeds of confusion there. We suggested making a completely new word up, which would sound like sup ainam, or roughly inhale water, mist or vapor. And currently it sounds a bit odd to the Thais we've tried it on, but it actually gets past the word buri, cigarette, before we come to that obstacle that we've seen so many other places. Factasia would like, okay, I did hear that. Factasia would like to ask if we can all start to simplify and unify the arguments and the terms we use for them. Reduce the message to its essentials to make things easier for non-experts. In fact, here's the chance for us all to get right what Honley admitted he got wrong 15 so years back when he coined the term e-cigarette. Proliferation of new products. Oh, that's Thailand. That's Thailand for you. There's road safety demonstration. And that's Honlik. In any case, whatever we say, opponents of tobacco harm reduction, the Sophie Chans of Hong Kong and Simon Chappers of Australia, will continue to attack us all for their own vested interests, whatever we say and however we say it. But sorting out the language we use is a chance to start talking to 2/3 of the world's smokers about something that could save their lives but currently they don't know about. I'm not quite old enough to remember World War II. But let me finish by borrowing a propaganda saying from that conflict, which is absolutely true today in this campaign: careless talk costs lives. Thank you.